In a move to help schools adjust to COVID-19 rules and regulations, the Board of Elementary and Secondary Education passed a set of guidelines.
But as Amanda Roberts explains, education leaders say schools need much more before they can open safely.
The union, representing Louisiana teachers and employees, fears opening schools too soon may be putting the lives of teachers, children, and many others at risk.
It was overwhelming in terms of how really afraid and anxious people are about returning. They don't want schools to become the next community spreaders.
President Larry Carter testified at the state board meeting that, per state guidelines, passed a minimum set of health and safety standards for Louisiana schools to reopen.
Perhaps the largest obstacle to keeping our students safe and teachers safe and all employees in schools safe is the lack of resources.
Once BESE sets minimum standards today, which are minimum standards, all local school systems have to then go in and make sure that they have adopted policies that comply with those minimum standards that BESE adopts today.
In these standards, State Superintendent Cade Brumley outlined the standards schools should follow in the age of COVID-19. They range from how many students should ride a bus in each phase, how students should be grouped in classes and separated when sick, sanitizing measures, and face covering guidelines for all age ranges. But what the guidelines don't offer is how schools will implement them. State health leaders testifying the difficult position this puts local school districts in.
They will be onerous on any school, but they will put that school in the best position to minimize as much as possible closures and absenteeism.
All that's going to take extra resources and in some cases extra staff and employees, and I'm just hopeful that if they push it back.
Carter saying while it's a good move for BESE to establish some kind of standard for schools across Louisiana, they need more help than just a piece of paper.
It's going to be the biggest piece, I think, past people talking about, do I wear a face covering or not? I think it's going to be about the funding to do not just the face covering issue, but the PPE, but also distance, making sure people are socially distancing, and then cleaning materials, cleaning supplies. That's costly.
BESE board members already want to add and expand to those guidelines. Those guidelines allow for the revisions, especially as more regulations come down from state, federal, and health leaders. Back to you.